Good evening. Welcome to a special edition of the International Grapevine. This is your host, Wallingford Lee. Tonight on the Grapevine, we're going to put on the spotlight on cancer. We want to talk about the dangers of cancer, and what better person to have to talk about this type of thing but a very experienced doctor. I'm talking about Dr. Louis Auguste, who happened to work at Sogar Medicine at Astra Medical Center in Long Island. Not only that, this doctor's been around for a long time. He has worked at LIJ. Very experienced doctor who has been a full commitment to the community in more ways than one. I had the pleasure of working with him many years ago on a program, a French program by the name of Face à Face, and we lost connection. It gives us really happiness and pleasure to have him on our show as our special guest. Welcome to our program, Doc.
Thank you, Mr. Wallingford. It's a pleasure to be here.
Thank you. It's good to have you. One of the things that we want to talk a little bit about cancer, the way that cancer is so dangerous, somewhat unpredictable at times, and how it affects a lot of us right here, not only in the United States, but all over America and Europe. So one of the things that we want to talk about is just exactly what is cancer, Doc?
Cancer, to put it simply, is the proliferation out of a cell in the body. It can be any cell. And normally the body, as you know, is made of a compound of cells. And they have a mechanism to allow these cells to maintain themselves, replicate themselves, but also to control them, to maintain the growth under control. When these control mechanisms are lost, then the cell can proliferate, can multiply, and then it can invade the body and then damage the normal functioning organs. So if it's, let's say, it's in the blood, then you end up having this multiplication of cells, for example, leukemia, for example, and the cells can infiltrate the liver, they can infiltrate the spleen, infiltrate the bone marrow, and causing a lot of damage. On the other side, you can have a solid tumor. It can develop in the breast, in the lungs, in the muscles, in the nerves. Basically, any organ in the body can develop a tumor. And then these tumors, there's a mass of cells that multiply, and as they expand, they can compress damaged organs, but also sometimes they can get into the bloodstream and disseminate, I call metastasis. They can spread from one organ to the other and cause a lot of damage.
Obviously, you talk about it spreading. I guess when it spread in the body is when it really get a little bit out of control, or it's all taking over your body, I would say. Wouldn't you say?
Right. So that's why, not all cancers are the same. And some cancers tend to be very limited to the site where they started. But some cancers from the start, they tend to be widespread. So it's very important to know, it's not just a matter of saying that you have cancer, but what type of cancer. That will dictate how to diagnose it, how to treat it, and what the outcome is likely to be.
One of the most important things that I find in a little bit of study that I did with cancer, the key component of cancer is getting to it early, as quick as possible. Going to your doctor to get the right treatment needed and to be aware of what you have and how to treat it. If you can get to it early, you can have some type of possibilities.
Absolutely. That's a very key. So that's why a person has to be very aware of his or her own body and to notice any change that can happen. And whenever they notice a change, to seek proper help, see a doctor, and so they can have proper testing. But in addition to that, every area in the world, they have a prevalence of certain diseases. For example, let's say in China, they would have a lot of cancer of the esophagus, cancer of the liver, which is less common in America, where you have more cancer of the breast, cancer of the lungs, and or let's say in the Caribbean, for example, let's say in Haiti, where you have a lot of cervical cancer. In Jamaica, you have a lot of prostate cancer. So depending on where you are, there are certain cancers are going to be more common, and you're going to have to be more conscious and then do screening, the proper screening. And depending on the help that's available to be able to detect these tumors early, because the earliest, like you said, the earliest you can catch them, the better the outcome is going to be.
Interesting. It seemed that, again, cancer is all over the world. But you mentioned a couple of places like Jamaica. It tends to be more prostate cancer. In other towns and other places, different type of cancer. Just exactly who gets cancer when we talk about cancer?
Well, anybody can get cancer. There is no one protected from cancer. You can have babies that are born with cancer. You have young children that in the first year of age, they develop cancer. But also on the other side, you can have people that are 90 years old, 100 years old that are developing cancer.
Wow.
Nobody is protected.
Wow.
And most of the cancers you're going to find will be in the like a 50, 60 range for most cancers. But you have some other cancers that are more prevalent in younger children. For example, what they call the sarcoma, cancer that develop in the muscles, tend to be more likely to be seen in the younger individual in their 20s. That's where you would be more likely to find them. And the cervical cancer, for example, and then is very common, as I mentioned, in Haiti, and in a lot of third world countries as well, and where it can be sexually transmitted because it's not necessarily the cancer that's transmitted, but the virus that causes the cancer that can be sexually transmitted.
I'm happy you mentioned cervical cancer. I read a little about cervical cancer. What usually causes cervical cancer in a woman?
Okay, so there is a virus called HPV. There are many types of HPV, but there are about 9 types that are most commonly responsible for the cancers. And these viruses can attack the cervix, and then if they're not properly treated, they can end up with first an early cancer that's on the surface, but as it grows undetected, it can become larger, can invade deeper into the organ, and end up causing a cancer that can kill the person because it causes hemorrhage. It invades the other organs in the body, and so that's one type of cancer that's caused by a virus. And then it's not the cancer itself is not contagious, but the virus that causes the cancer is contagious.
Is it more prevalent in people of color, African Americans, or Black people in general, or it's just general cervical cancer?
Well, it's a pretty common cancer. The difference is that in America, in the more developed countries, they have screening programs that allow you to detect the cancer while it's still very early. While most of the third world countries don't have this ability. It's amazing to see that there was a pathologist called Papa Nicolau that developed a technique called a pap smear that allows
for women.
Exactly. And then since that, they've been able to reduce the mortality of cervical cancer in America to near zero. Yet, that's the most common killer of women in Haiti, for example, because there is no screening, there is no early detection, there is no early treatment. And most of the time, by the time they find out the person has a cancer, it's already too late. Yeah.
I guess so. I would think that the pap smear is extremely important with women, especially if they're start having sex and stuff like that. It's important to go to your doctor, have the proper pap smear, and to find out what's going on, in terms like that.
That's very important. In fact, in the U.S., it's a standard that you should have pap smear, while during your your sexually active years to have pap smear every 3 years. Every 3 years, and if there are any changes, it might be more often. But if it's normal, you can have it every 3 years, and then basically the now I know in one of the questions, I don't know you want to talk about this right now. You asked me if there could be a vaccination for cancer.
Yes, I
Maybe
did
you
ask
want
that
to
question.
talk about this now or later
No, we'll talk about down the road.
down the road. Okay.
But one of the things that gets to me, I wanted to find out, because I read always in the newspaper and in the media, you hear about cancer. How widespread is cancer in this nation?
Well, in the U.S., cancer is second only to cardiac disease as far
Wow.
as the number of death in the population, and only cardiac disease are more prevalent than cancers. And among women, the most common cause of cancer death is lung cancer. And then the most common cancer in women is breast.
Breast cancer, yes.
But right now, because there have been so many successes, so many advances in breast cancer, that the mortality of breast cancer has decreased. But since women have been slow at getting rid of the cigarettes, and then so now since the 1980s, the mid 1980s, lung cancer has become a more common killer of women than breast cancer.
I remember in the late 80s and early 90s, breast cancer took a lot of lives, a lot of sisters, mothers, grandmothers. It was such a dangerous thing, and it was a real killer. Is there a particular reason why it has slowed down and now it's not the number one in women? Is it because of better medication, better care, or awareness?
Well, I think it's a combination of all that. All that. First, awareness. I think the women have gotten the message that it's important to do screening. But although even with that, you don't have 100% compliance with the recommendations. And one of the factors was lack of insurance. And when Obamacare was voted, and you could see all the statistics showed there was a significant increase in the number of women having their screening mammograms, and then also there was a gap between white and women and women of color, and with the Obamacare, that gap had narrowed. You had almost as many black women having mammograms as you had white women. But unfortunately, that this might be on the chopping block, with the what's going on right now in the Supreme Court, where they're trying to take down the Affordable Care Act.
I know. Well, as we continue here on International Grapevine, talking about something as dangerous as cancer that has been spread not only in the United States, but all over the world, we feel lucky and gifted to have the opportunity to have an expert as this doctor talking about cancer in general and breast cancer. We'll be right back on International Grapevine as we continue to dig forward talking about cancer. We'll be right back. You're watching an episode of the International Grapevine. This is your host, Wallingford Lee, a weekly program that deals with everyday issues that impact our lifestyle, such as the economy, real estate, education, and employment, just to name a few. Welcome to our weekly program. That's on YouTube and also Facebook, the International Grapevine. And we're back here in International Grapevine talking about the dangers of cancer in general. There's so many different types of cancer. We might not be able to cover all of them tonight, but we started talking a little bit about how cancer gets in your body, how it's spread in your body, the dangers of it. It can get young people, it can get middle-aged people, it can get old people, it can get very, very young. So again, education and preparation and asking the right questions when you go to the doctors is important. On the second half with Dr. Augusta, we want to talk about symptoms, if there's any symptoms in cancer, and if there's any possibility of vaccination, because some of the things change so much. Doctor, one of the things that I want to, because we talk about breast cancer a little bit, the mammogram, which is a little bit uncomfortable for women because they're put onto a machine and the breast is kind of pressed down on. What are they looking for in the mammogram when they do the mammogram?
Sure. So the mammogram is the most valuable tool in the screening for breast cancer, and it can detect very early cancer and advanced cancer as well. So one of the earliest signs of a cancer would be what they call calcifications, microcalcifications. You see little dots, little white dots in the breast, and they tend to be in the cluster. And it is not isolated dots. You have clusters of these little dots that make you suspicious. Whenever you see that, you want to do a biopsy. That would tell you what if there's a cancer or what kind of cancer it is. And because it's not always that this calcification would show a cancer, but that's whenever you see these calcifications, there's probably about 25-30% chance that you would have a cancer in there. So
but it's very important, the biopsy. The biopsy in itself will give you a clearer picture, I would think.
Exactly. So the calcifications, then you can have, as the tumor develop, you're going to have a mass. A mass, usually it's also it looks like a whitish spot that can be small, can be big, and then it has certain characteristics. It tends to be irregular, and also if the person is having mammograms every year, you would see that 1 year is completely clean, and then a year later there could be something that you didn't see before. It's a new finding that should make you worry that it could be a cancer. And also if there is a mass there, that white spot in there tends to be irregular, that could be also a sign of cancer. And so that's what we look for on the mammogram. But the mammogram in a younger person is not that accurate because the breast of the younger person is very dense because they have a lot of estrogen in the body. And then so in a case like that, you would want to do a second test called a sonogram. The sonogram would sort of make the mammogram more valuable because it completes the information you get from the mammogram.
That's why we cannot insist enough to say early detection in these type of things are more important, especially with breast cancer, to cover your breast so you don't lose it. Don't be afraid to go to the doctor. Don't be afraid to do your mammogram. To ask the proper question. It's your health, and it's a very important thing. How advanced is the cancer in the breast when the doctors have to decide that they're going to have, some type of surgery in the breast?
Well, whenever you have a cancer in the breast, unless it has spread all over the body, you're going to need some kind of surgery. And then, sometimes the surgery can be the first treatment, sometimes it can be second or third, or sometimes it can be not an option at all. But most of the times, if it's early cancer, you'd want to do surgery first because not only it removes the tumor, it allows you to know the stage of the tumor, whether the tumor is limited to the breast, whether it has spread to the lymph glands in the armpit, and then also the other tests, you can do scans of the body to see if there are any tumor in the lungs, in the bones, or liver, or wherever. So with all this information, you can what they call stage the tumor, see whether you have stage 0, stage 1, 2, 3, or 4. And based on that, you can do the proper treatment. So sometimes the surgery might be the only thing you need to do, but most of the times you would like to add something to it, either to hormonal therapy, either some chemotherapy, or some radiation, or sometimes all three, or sometimes 2 out of 3.
It's important to let women know that the medical field is so advanced that sometimes, even if, God forbid, a breast has to be removed, there are some form of reconstruction in the surgery to cure that part of the body and give that woman that same look that she had before. Am I right or wrong?
Absolutely, absolutely. So, one more plug you want to make for early detection, because if the tumor is detected at an early stage, most of the time you can preserve the breast. You don't have to do a mastectomy. You could do what they call a lumpectomy, just take out the lump, and you have
Yes.
treated with radiation as well. So, but still, sometimes you might have to do a mastectomy for different reasons. Either because the mass is too large. Let's say the mass is large and the breast is small. So in that case, you're better off having to remove the breast and reconstruct it. Or some people sometimes have two or three different cancers in the breast. In a case like that, you cannot, save the breast. You have to remove it. And sometimes you do have a situation where the person had breast cancer before and developed a second cancer in time. So 5 years, 6 years, you have a second cancer. Again, in this case, you would want to do a mastectomy. But like you said, if the tumor is picked up early,
Early.
then you would want to do reconstruction. And there are many advances in reconstruction. You can either use an implant, or you can use your own tissues. You can skin from your belly and transpose it in the chest to reconstruct the breast. They're beautiful results. And so definitely, one thing I always tell the women, the fact that you have been diagnosed with breast cancer is not a death sentence. Okay, we're very successful now. Anybody that has a cancer detected at say 0, 1, or 2 has an over 90% chance of surviving that cancer. 90%. So that's what you have to look, because don't desperate, don't be
Don't
depressed,
panic.
because there are ways to help to make you live a long life.
And that's why a few minutes ago I said the importance of how a medical field has advanced so much. There's so many good medication, excellent doctors out there under the right circumstances. If you come to them early or in any type of condition, they do the best, save your life, save quality of life. Is cancer contagious, doctor?
Right. So as I mentioned before, cancer in itself is not contagious.
Okay.
You're not going by taking care of a person. Let's say you have a family member who has cancer. You're not going to catch cancer. However, there are some cancers that are caused by viruses. For example, we talked about the cervical cancer, which is caused by HPV, human papillomavirus. And you
Right.
have a liver cancer that's very common in Asia, that's caused by the hepatitis virus. And those are the viruses can be contagious, but the cancer in itself is not contagious.
Well, one of the reasons why I brought up I have read and I've seen in some cases, not a lot, where sometimes the grandmother has cancer and the daughter catch the cancer and it passed down in some family, not in all. So that kind of triggered my question, whether it's contagious or it's a family tree situation, then you get it.
Sure. That's a very good question. And in fact, when you see a person, with the breast cancer or any cancer, you want to do what they call a family history. You want to see, you want to go 3 generations, the grandparents or the great grandparents, the grandparents and the parents, to see what kind of, if they died, of cancer, if they die young. Sometimes if they die very young, that might not be very helpful because somebody dies of an accident at age 35, so that really won't help you. But if you tell you that the mother had the cancer when she was 35 and the grandmother had cancer when she was 50, the great-grandmother had the cancer when she was, let's say, in the 60, that start making you think that it probably is a family trait that is being passed on. And then we've made a lot of progress in that, because now it started with the 2 genes, the BRCA1, BRCA2, which are the breast cancer genes that were first isolated. And then they're responsible for breast cancer, ovarian cancer as well. And then, so we know exactly, what gene are affected by this mutation. And also we know exactly how it's passed on, because it's passed on it's passed on from generation to generation, and it's not just women. Men can get it as well,
Sure.
and
Sure.
you can have, particularly if you see a man with breast cancer, there's a very good likelihood that person might be a carrier of that gene mutation, and that person should be tested, and the children should be tested as well. So whenever you isolate that mutation, you find that mutation in the gene, that doesn't mean that every single child is going to have it, because it's a dominant gene. What they call it is has a high penetration. That means if you have it, there's an 80% chance that you're going to have cancer yourself. But only 50% of the children are going to inherit that gene, because when the gene splits, and so you only get half of it, and so you have 50% risk that you would have the gene that your mother or your grandmother is passing on to this generation. Also, although the penetration is high, it's about 80%, you still have 20% of women with the gene that may not have cancer, but still can pass it on to the children.
Wow, interesting, interesting. One of the things that because I like to do research, can cancer be cured at all, or can only be put in remission? Can it be cured?
Sure. So it's a very, I would say, difficult term to use when dealing with cancer. And because, let's say, for breast cancer, I've seen women that were treated that were doing very well, and 20 years later, they come up with a recurrence of the cancer. So whenever you've been diagnosed with cancer, there is no safe period. Certainly, the first 2 years are the most dangerous periods. But as time goes, and then you become less likely, and then so the surveillance is going to be less tight, but you still should not stop following the patient, because I have seen as 10 years later, 11 years later, 20 years later, I had a patient that was passed on, to me by another, surgeon who retired. I was following that patient, and 22 years after she had the surgery, she had a recurrence of her breast cancer.
Well,
So
that's very interesting, because one of the questions that I put to you and I sent it to you is what it means when the doctor said to you, well, you have cancer, we work on you, and right now the cancer is in remission. And that covers part of what you just said, that you can stop it, but the possibility exists that it could come back. So when the doctor tells you it's in remission, well, right now you're okay. But the question is, down the road, what could happen?
Sure. So there are cancers, I would say, that absolutely can be cured. For example, if you're talking about stage 0, that's what they call in situ cancer. That's a cancer that's very, very early, hasn't in the wall of the duct, the milk duct in the breast, hasn't crossed the barrier, doesn't have the ability to spread to the lymph nodes or to the blood anywhere. So if you were to take that lesion out, then you can cure the person. However, you still can have the tumor appear in the other breast, or if you then do a mastectomy, you can see it in that breast again. So again, you have to always continue to follow that person, even though they have surgery and they have a good prognosis. And finally, I think you can only say the person was cured, let's say, at the end of the person's life. Let's say the tumor never comes back, you say the person was cured. But you should never stop following a person with the cancer. I mean, you might, again, you might slow down the follow-up. You might see the person once a year, do the mammogram, do some blood tests, but also make the patient aware that any symptoms, they're losing weight, they're having pain somewhere where they didn't have pain, and they are losing the appetite, they're losing weight. They're all signs that should make you alert the possibility that the cancer might have come back. But you can have a long survival from cancer.
We have approximately 3 minutes, and I need to ask you this question, because right now, the last year or two, it's been happening. How widespread is pancreatic cancer, and what usually causes pancreatic cancer?
Okay. Pancreatic cancer is probably one of the deadliest cancers. And then is deadly because very for two reasons. And because you have three parts in the pancreas. You have the head of the pancreas, the body of the pancreas, and the tail of the pancreas. And then the tail of the pancreas is a very silent area. The tumor can grow very, very large and not cause any symptoms. The body, which is the middle part of the pancreas, as the tumor grows, it can invade the nerves. It can give you back pain. Okay, and that might be a sign that make you want to go and get either a sonogram or a CAT scan, make you see that tumor. The cancer usually you pick up the earliest is the cancer in the head of the pancreas, because through the head of the pancreas, you have the bile duct that takes the bile from the liver down into the small bowel. And when the tumor develops in the head of the pancreas, it blocks that. And so instead of going down, the bile going down into the intestine, it flows back into the blood. The person
So that creates a little bit of a symptom, so to speak. Do you have a symptoms in that to know that something's wrong with the pancreas?
Well, first, your eyes will become yellow. Your eyes become yellow, and you see the person has the darker hue. And
Wow.
also, because the bile salts are retained in the body, you start itching. You're scratching all over your body, and that's another sign of it. And the other sign you can have some fullness. When you examine the person, you can feel a large mass in the right upper quadrant of the abdomen, because the gallbladder is blocked. It's not emptying itself out. It has gotten very big. And then those are the signs you can expect. But the earliest sign would be like a jaundice. Anytime you see somebody with jaundice, and you have to rush and do all the investigation possible to make sure that's not the case. And then so that's one of the problems with pancreas, because the signs tend to develop pretty late when they're already pretty large. But the second problem with pancreatic cancer is that it tends to spread very quickly. And most of the times, I would say probably 90% of the time, when somebody comes with pancreatic cancer, it has already spread to the lymph glands or to the liver. And so that's why generally I'll say about 10 to 20% of the people who are diagnosed with breast cancer will be able to be operated on. In 80% of the times, they're already beyond surgery. You have to use chemotherapy, radiation to treat it.
Well, doctor, on that note, unfortunately, because of time, we have to say goodnight, but we want to take this opportunity in behalf of the family of the Grapevine, which is a large family of New York, in terms of Westchester, Long Island, Queens, and all over, to thank you so much for imparting so much vital information to our audience. And we don't have words to thank you for that, and hope that you'll be kind enough to come back on the Grapevine to share some more detailed information as you have tonight about cancer.
Absolutely. So feel free to come, because I think it's very important for the community to learn about cancer, because that's the key for survival. Because early detection is very important, and more information we can spread around, the better it will be for the community. So
I
feel
couldn't
free to
agree
call
with
me.
you. I agree with you 100%. And again, this is Wallingford Lee saying goodnight for the International Grapevine. I'm saying to you, I hope that this information tonight has been important to you. We hope to see you next week at the same time and at the same place.